The Ministry of Health is to prioritize the upgrade of the community-based health planning and services CHPS compounds in the rural areas. It has therefore challenged the Ghana Health Service to review its policy to provide an almost equal distribution of doctors to areas whose access to medical facilities still remains a challenge. The Health Minister, Dr. Kwaku Agyeman Mensah, made these assertions when he paid a working visit to agencies under his ministry. The move was aimed at helping the ministry to strategize on effective ways to improve the overall healthcare delivery system in the country.
The establishment of the Ghana Health Service is an essential part of the key strategies identified in the health sector reform process. The GHS is mandated to create necessary steps in establishing a more equitable, efficient, accessible and responsive healthcare system. But the service is bedeviled with some challenges. The Director General, Dr. Ebenezer Piadinchua, noted that as a result of inadequate funding, there are stagnation problems associated with the achievable goals of Millennium Development Goals 4 and 5. He said, GHS now is focusing on collaborating with stakeholders to make health delivery conducive for all, especially in the area of resource and research centers, rehabilitation of basic equipment, and regional health stores. The Minister, Dr. Kwaku Agyeman Mensah, described the service as the pivot of the ministry and said his ministry would help it become a cost-effective sector.
So it's very important that we strengthen the PPMED at the headquarters to be able to monitor, the operations of all the agencies in the sector. I mean, working hand in hand with the agencies. It is important that we all agree to pay attention to primary health care, the CHPS compound, the health centers. Yes, it's nice if you have a state-of-the-art hospital, but how many Ghanaians can access that or will access that? So it is important that we all pay attention to this CHPS compound.
The National Health Insurance Authority was next on the minister's agenda. Interacting with the Health Minister, the Chief Executive Officer of the NHIA, Mr. Sylvester Mensah, noted that the National Health Insurance Scheme over the last few years had seen significant growth. He said the number of people who visit the various hospitals across the country had increased. For the last year, outpatient utilization of the NHIS rose to 27.4 million Ghana cedis from 16.6 million Ghana cedis in 2009 and 597,000 in 2005. The NHIA has also paid 748 million Ghana cedis in claims in 2013 as compared to the 362 million Ghana cedis in 2009.
We have submitted recommendations to government through the Ministry of Health regarding the possible increase of the NHI levy. We are also asking for a review of the exemptions of VAT, which seem to also reflect on the health insurance levy. We've also proposed a 5% of road fund to be assigned to health insurance because all emergencies are covered under the scheme. So road accidents and all that contribute to our costs. We've also recommended a levy on tobacco and alcoholic beverages since they are all hazardous to health and could also feed into inflows.
The Minister for Health, Dr. Kwaku Agyeman, congratulated the authority for its success despite the challenges it faces in executing its mandate. He had a word of advice for officials of the authority.
As you move into the region, it is important that old or retired medical doctors or those who have worked in the medical field should be part of the public campaign. Because if you come to Ashanti region, you say, Sylvester Mensah is addressing, people will not listen. An old doctor who has stayed there, he has practiced, they know him, they trust him. So if he is telling them that, look, this is good because of A, B, C, D, they are prepared they'll be prepared to listen.
Under the Ministry of Health oversight, the NHIA is extending capitation to 3 more regions in the second phase of the implementation, namely the Upper East, Upper West and Volta regions.